Good day, everyone. Our topic today is pallor or paleness of the skin or other parts of the body. Pallor can be defined as a pale color of the skin that can be caused by illness, emotional shock, or stress. Also, stimulant use or anemia. These are the causes of pallor, and we should be expanded later. Now, this is visible in the conjunctive of the eyes on physical examination. And once the patient comes to the clinic and you on physical examination, when the eye is inspected and it's so obvious in the conjunctive eye in which the paleness will be so conspicuous. Pallor is more evident on the face and palms. It can develop suddenly or gradually, depending on the cause. It is not usually clinically significant unless it is accompanied by paleness of the lips, the tongue, the palms, the mouth, and other regions with mucous membranes. Having said that, it's now we want to look at what are the causes of pallor. Osteoporosis. That's the first thing we want to look at of the causes of pallor. Osteoporosis is a disease in which bone weakening increases the risk of a broken bone. It is most common reason for a broken bone among the elderly. Bones that commonly break include the vertebrae in the spine, the bones of the forearm, and the hips. So, when a patient has a broken bone, it's usually associated with reduced amount of oxyhemoglobin in the blood system, and this is one of the causes of pallor. Having said that, vitamin D deficiency, when the patient has a less or depletion of vitamin D in the blood system. And when this is below normal, symptoms may include muscle pain, weakness, muscle contractions, though most have no symptoms. And when the bones are demineralized, it's one of the causes of osteoporosis when there is a deficiency in the amount of vitamin D in the blood system. And this is caused by inadequate exposure to sunlight. You can see now, getting adequate amount of sunlight is very healthy and is very beneficial into the body. And when you have decreased dietary intake, kidney problems, decreased absorption from the gut, another risk factor including liver disease and certain genetic disorder. These are the causes of what you call depletion in the vitamin D in the blood system. And having this depleted, you have what we call pallor. Also, we have anorexia. You might wonder what anorexia means. Anorexia can be referred to an eating disorder characterized by low weight and food restriction. When a patient is showing, demonstrating these symptoms, the patient will have a paleness due to demineralized minerals in the body. Having said that, also we have anemia. This is the major cause of pallor in the body system of a patient. Anemia is a decrease in the total amount of red blood cells or hemoglobin in the blood, and a lowered ability of the blood to carry oxygen. When anemia comes on slowly, the symptoms are often vague and may include feeling tired, weakness, and shortness of breath, and a poor ability to exercise. When the anemia comes on quickly, symptoms may include confusion. The patient will be having confusion. The patient will feel like passing out, loss of consciousness, and increased as feel like drinking so much water. And this is one of the causes of pallor or paleness in any patient. Cancer. When the patient have cancer, is a group of diseases involving abnormal cell growth with the potential to invade or spread to other parts of the body. And in some cases, the patient will have abnormal production of white blood cells. When the presence of white blood cells are more than the presence of red blood cells in the white blood cell will override the functionality of the red blood cells and will cause depletion in the amount of hemoglobin level in the body of the patient, resulting in pallor or paleness of the skin. Leukemia. I've said earlier, cancer. This is leukemia is a group of blood cancers that usually begin in the bone marrow and result in high numbers of abnormal cells. These blood cells are not fully developed and are called blast or leukemia cells. Symptoms may include bleeding, bruising, feeling tired, and an increased risk of infection. These symptoms occur due to lack of normal blood cells. And when the patient experiences this, the patient will have a decreased level of blood in the blood cells or in the body system of the patient. Also, medication. There are some medications that, once taken, can reduce the level of hemoglobin in the body. We have cannabis, ethanol, amphetamines. These are hard drugs, and once taken, can reduce the level of hemoglobin in the blood. So that's why you advise people not to take some of these hard drugs because they enhance the reduction of level of hemoglobin in the blood. Heart disease. You might wonder what heart disease means. Cardiovascular disease is a class of